That flutter in your chest, the one you feel some evenings when you finally sit down, the little skip that makes you cough or hold your breath for a second. You have probably blamed it on stress or too much coffee, but a lot of the time that skipped beat is your heart's electrical system asking for two minerals it is quietly running short on, and most people never find out because a standard checkup often does not go looking. I am Dr. Hale. I have spent 15 years in internal medicine, and if there is one complaint I have heard in 1,000 slightly different forms, it is this. Doc, my heart feels like it skips, racing at odd moments. A thud, then a pause, then a thud. Most of the time it is not a heart attack and not a disaster. But it is also not nothing. Very often it is a signal that the electrical side of the heart is not getting the steady supply it needs. And two minerals sit right at the center of that story. So in the next few minutes, I am going to walk you through how your heartbeat is actually generated, why potassium and magnesium are the two minerals that keep that beat regular, what pulls them down without you noticing, and the one well-meaning fix that people reach for on their own that can be genuinely dangerous. That last part matters, so stay with me. This is the kind of thing that sends people to the emergency room when they were only trying to help themselves. Let me start with the machine, because your heart is not really a pump that happens to have some wiring. It is a piece of wiring that happens to move blood. Every beat begins as a spark. Tucked into the upper part of your heart is a small cluster of cells that most people have never heard of, sometimes called the heart's natural pacemaker. On its own, without any command from your brain, it fires a tiny electrical pulse, roughly once a second, all day, all night, for your entire life. That pulse spreads across the heart in a set pattern, telling the chambers when to squeeze and in what order, top first, then bottom, so blood moves the right way. Think of it like the spark timing in an engine. The fuel and the pistons matter, but if the spark fires at the wrong instant, the whole thing runs rough. Your heart is the same. The rhythm is electrical before it is ever mechanical. Now, where do potassium and magnesium come in? To understand that, you have to know what makes that spark possible in the first place. Every heart cell holds a small charge, like a battery that is kept loaded and ready. It builds that charge by carefully pumping certain minerals in and others out, keeping potassium mostly inside the cell and sodium mostly outside. When the signal to beat arrives, the cell lets those minerals rush across in a precise order, which creates the electrical pulse, and then it resets, pulling everything back into place so it is ready to fire again a fraction of a second later. Potassium is the main player in that reset. It is what allows the cell to recharge cleanly and fire on time, beat after beat. The National Institutes of Health, through its Office of Dietary Supplements, is clear on this. Potassium is central to the electrical signaling that runs muscle and nerve, and low potassium, what doctors call hypokalemia, can cause abnormal heart rhythms, especially in people who already have heart trouble. When potassium runs low, those heart cells become jumpy and irritable. They fire when they should be resting. And that misfire is what you feel as a skipped beat, a flutter, or in more serious cases, a genuine arrhythmia, a heartbeat that has lost its steady timing. Magnesium is the second half of the pair, and here is the piece almost nobody explains. Magnesium is the mineral that runs the pumps. Remember those little pumps that keep potassium inside the cell where it belongs? They need magnesium to work. The NIH points out that magnesium is required for the active transport of potassium and calcium across cell membranes, a process that is central to a normal heartbeat. So magnesium is not just a bystander, it is the electrician that keeps the potassium wiring in the right place. This is why the two minerals travel together in the body and in the clinic. If your magnesium is low, your body struggles to hold on to potassium no matter how much you take in, because the pumps that store it are understaffed. You can pour potassium in the top and watch it leak straight out the bottom. The picture I want you to carry is this. Your heartbeat is a spark on a timer. Potassium is the charge that lets each cell fire and reset on schedule. Magnesium is the crew that keeps that charge where it belongs and steadies the whole circuit. When either one drops, the timing gets sloppy. And sloppy timing in the heart has a name: arrhythmia. Now let me show you how real the link is, because this is not a fringe idea. Major heart research backs it. Work connected to the American Heart Association, including findings from the long-running Framingham Heart Study, has reported that people with low blood magnesium have a higher chance of developing atrial fibrillation, the most common serious irregular rhythm, which is itself a leading cause of stroke. Low potassium shows up in the same territory, linked to irregular beats, and, in people already at risk, dangerous ones. Cleveland Clinic and other major centers describe arrhythmia in exactly these electrical terms: a problem of faulty signaling rather than a weak pump. So when I tell you these two minerals sit at the center of your rhythm, I am not reaching. I am describing the plumbing of the beat itself. Before I tell you what drains these minerals, let me give you the quieter signs, because a skipped beat is rarely the only clue. When potassium and magnesium run low, the same electrical restlessness that stirs up the heart shows up in the rest of the body too. The NIH describes it plainly. As magnesium falls, people can get muscle cramps and twitches, numbness or tingling, unusual weakness, and a general fatigue that sleep does not fix. Low potassium brings its own version: muscle weakness, cramping, and that same tired, wrung-out feeling. So the picture is often bigger than the chest. It is the leg that cramps at night, the eyelid that flickers, the arms that feel heavy on the stairs, and then, in the evening, the flutter. Any one of these alone is easy to shrug off as age or stress. Together, they are a pattern, and the pattern points at the wiring. Let me make this concrete with a person. I am going to call him Dennis, and I want to be honest that he is a composite, built from many patients I have seen, not one man. Dennis was 58, active, a little proud of how healthy he was. He came in rattled because his heart had started doing that skip and thud, mostly in the evenings, sometimes enough to make him lightheaded. He was sure something was badly wrong. Two things stood out when we talked. First, he had been put on a water pill, a diuretic, for his blood pressure about a year earlier. Second, his diet, which he thought was clean, was heavy on processed and packaged food and very light on fresh produce. He was getting a flood of sodium and almost no potassium or magnesium. His body was slowly being drained of the exact two minerals his heart's wiring depended on, and the skipped beats were the alarm bell. Dennis is the reason I made this video, because his story is common, and most of it was fixable. So what pulls these minerals down? Let me give you the main culprits, because you may recognize yourself here. The first is water pills, the diuretics that millions of adults take for blood pressure or swelling. They work by making your kidneys flush out extra fluid and sodium, which is helpful, but many of them flush out potassium and magnesium right along with it. The medical literature is clear that both loop and thiazide-type diuretics can lower these minerals, and the thiazide type in particular is tied to low magnesium, more so as we get older. This does not mean the pill is bad or that you should ever stop it on your own. It means that if you take a diuretic, these are exactly the minerals worth a conversation with your doctor about, because the very thing controlling your blood pressure may be quietly nudging your rhythm. The second culprit is the modern plate. Our diets have flipped the balance our bodies expect. We eat a river of sodium from packaged and restaurant food and only a trickle of potassium from fresh plants. Our ancestors ate the reverse. Your heart's electrical system was tuned for high potassium and low sodium, and most people now feed it the opposite. Magnesium tells a similar story, because it lives in the foods many of us eat least: the leafy greens, the beans, the nuts, the whole grains. There is a fourth drain worth a quick word, because it catches fit, health-minded people off guard. Hard sweating and heavy exercise pull these minerals out too, and so does frequent alcohol, which nudges the kidneys to spill both potassium and magnesium. So the very person who thinks they are doing everything right, the one who works out hard, sweats a lot, and unwinds with a couple of drinks, can end up running lower than the person on the couch. If that is you, it is not a reason to stop moving. It is a reason to replace what you lose from food and fluids, and to notice if the skips cluster on your heaviest days. The third is age itself, working through the background. As we move through our 50s and 60s, the gut absorbs some minerals a little less well, the kidneys hold on to them a little less tightly, and we tend to take more of the very medications that deplete them. None of these is dramatic on its own. Together, they explain why a mineral shortage can build for years while your yearly blood work still looks unremarkable, since the routine tests do not always tell the full story of what is happening inside your cells. Now, here is the loop I opened with, the fix people reach for that can be dangerous, and I need you to hear this part clearly. When someone learns that low potassium can cause skipped beats, the natural reaction is simple. If low is the problem, I will just take a lot of potassium. Please do not do that on your own. Potassium is one of the few minerals where too much is every bit as dangerous as too little, and in some ways more so. Too much potassium in the blood, called hyperkalemia, can slow and destabilize the heart, and, at the extreme, stop it. Your kidneys normally clear the excess, but here is the catch. Some of the most common heart and blood pressure medications change that math. The widely used blood pressure drugs known as ACE inhibitors and ARBs, along with a class called potassium-sparing diuretics, all cause your body to hold on to more potassium. Add reduced kidney function, which many people over 60 have without knowing it, and a big potassium supplement or a heavy dose of salt substitute, which is often potassium chloride, can push levels into a dangerous zone fast. This is not a scare tactic. It is the single most important safety point in this entire video. High-dose potassium supplements are not something to self-prescribe. They belong to you and your doctor together, guided by a blood test. So what should you actually do? The answer is calmer and safer than a pill, and it works with your body instead of against it. Food first, and balance over megadose. For potassium, think beyond the banana, though the banana is fine. The richer everyday sources are things like potatoes and sweet potatoes with the skin, beans and lentils, leafy greens, tomatoes and tomato sauce, avocado, oranges, yogurt, and fish. The beauty of getting potassium from food is that it is almost impossible to overdo it this way if your kidneys are healthy, because whole foods deliver it slowly and in the company of everything else your body expects. For magnesium, you are looking at a similar aisle. Pumpkin seeds, which are one of the densest sources there is, plus almonds, cashews, spinach, black beans, edamame, and whole grains. Notice how much these two lists overlap. A plate built on plants, beans, and a little fish is quietly feeding both sides of your heart's electrical system at once. Let me pause for 1 second, because if this is helping you understand what is going on in your own chest, that is exactly why I make these. Take a moment to subscribe to Dr. Hale, and tell me in the comments how old you are, whether you are 46 or 71, because the ages of the people watching really do shape what I cover next. It genuinely helps. All right. Let me give you the rest, including where a supplement fits and where it does not. On magnesium supplements, there is a bit more room than with potassium, because magnesium from a sensible supplement is generally safer for people with healthy kidneys, and many adults do run low. If you and your doctor decide to try one, the form matters. The cheapest kind on the shelf, magnesium oxide, is poorly absorbed and mostly runs through you. Better absorbed forms include magnesium glycinate, which is gentle on the stomach, and citrate. But, And this is the same rule as potassium in a softer version. If you have kidney disease or take heart medications, even magnesium deserves a check with your doctor first, because reduced kidneys clear it less well. The theme of this whole video is not more. It is balanced and steady and checked. Now let me correct a few myths, because they get people into trouble. First myth. A skipped beat always means something is wrong with the heart muscle. Not so. Very often it is an electrical hiccup, and mineral balance is one of the common fixable reasons behind it. Second myth. If my potassium were low, my doctor would have caught it. Maybe, but a single blood draw can miss a shortage that lives mostly inside your cells, and magnesium in particular is not always on a standard panel unless someone asks for it. It is fair to ask. Third myth. Salt substitute is automatically a heart-healthy swap for everyone. For many people it is helpful, but most salt substitutes replace sodium with potassium, and for someone on the wrong medications or with weak kidneys, that innocent-looking shaker can be a real risk. Know which group you are in before you switch. So let us pull this together into something you can act on. Here is what to do, starting this week. 1. Build your plate the way your heart's wiring expects. More potassium-rich whole foods, potatoes with the skin, beans, greens, fruit, and less packaged salty food. 2. Feed your magnesium too, with a daily handful of pumpkin seeds or nuts and a serving of greens or beans. 3. If you take a water pill for blood pressure, do not stop it, but do ask your doctor at your next visit to check your potassium and magnesium and whether your dose or type still fits you. 4. Leave high-dose potassium supplements and salt substitutes alone unless your doctor has specifically told you to use them, especially if you have kidney issues or take blood pressure medication. And 5. Treat frequent palpitations as a reason to get evaluated, not something to silence with a pill you bought yourself. Now the honest safety lines, because rhythm is one area where I will not soften the edges. Everything here is education, not a diagnosis, and it does not replace your own doctor, who knows your kidneys, your medications, and your history. An occasional skip that comes and goes, with no other symptoms, is extremely common and usually harmless. But some things are not for waiting. If your heart races or pounds often and will not settle, if a fluttering or irregular beat comes with chest pain, with shortness of breath, with dizziness, or with any feeling that you might faint, do not sit at home and read about minerals. That combination needs urgent medical attention, sometimes a same-day emergency room visit, because it can signal a rhythm problem that needs real treatment now. And if you ever actually pass out, that is an emergency, full stop. The minerals are for the long, quiet work of keeping your rhythm well supplied. They are not the answer to an alarm going off in the moment. So take what you learned here to your doctor or pharmacist. Ask about your potassium and magnesium, especially if you are on a water pill. Ask whether a supplement makes sense for you or is a risk for you. Let someone who can see your labs and your medication list make that call with you, not a video and not a comment section. And here is the thread I want to leave you with. Today was about the two minerals that keep the beat regular, potassium and magnesium. But a steady rhythm is only half of a healthy heart. The other half is the muscle itself, and how hard it is forced to work, day after day, against the pressure in your arteries. There are quiet signs, ones people write off as getting older, that your heart is straining harder than it should long before anything shows up on a routine visit. In my next video, I am going to walk you through those early warning signs of a heart that is working too hard, so you can catch it while it is still easy to help. Subscribe so it reaches you. Whether you are 45 or 75, the rhythm that has carried you your whole life deserves the right supply and a little attention. Feed it well, respect the safety limits, and let your doctor be your partner in it. I am Dr. Hale. Take care of yourself.